Hey, good afternoon. This is Bill Bird, Chief Medical Officer at CGH Medical Center. Welcome to Facebook Live. Glad you could join us either live or recorded. And I'm gonna mix it up a little bit today, and then I'm gonna talk a little bit about COVID-related issues first, because we're gonna be talking to our emergency management services manager, and then we have a little video after that I kind of wanted to go and show you that I think you'll find interesting, a little field trip that I did today. So let's start and talk about COVID first, and the pandemic. First of all, let's see, there we go. See that? So I had a vaccine today. I had the COVID vaccine this morning, and so far so good. I keep thinking, oh, am I gonna feel something here? And the odds are, like I talked about last week, that are mild symptom-wise. Most people that get the immunization will have some mild symptoms, so I anticipate that happening. But so far, so good. So we've begun that process today at the hospital, and we'll be giving vaccinations through Saturday. Now, I think one of our marketing staff had said there are some questions that already come up about general public and vaccines. I don't have great detailed information on that. My understanding is that in terms of nursing facilities, that actually, if I remember right, Walgreens and CVS may have that. Maybe another pharmacy, but that they're going to be getting out and going to, long-term care facilities to get people in those facilities, both staff and patients, immunized here in the very near future. And then what I've read is we're talking sometime in the next 2 to 3 months or so for begin rolling this out to the rest of the public, and hopefully by the time we get to June, we'll have anyone who wants to have the vaccine will have the vaccine. And obviously, the more the merrier in terms of herd immunity. So I'm all for getting as many vaccines as soon as we can to folks. So that's where we stand in terms of the vaccination stuff. For our hospital, we continue to have patients who have COVID who are hospitalized, and it's not the surge number that we had back about a month ago, but it is definitely far more than we had in the summer. So is it manageable? Yes. Are there still people in our area who are getting sick with COVID and end up in the hospital? Yes. So I first of all want to thank those of you who are watching, and those other folks in the community too, who I really sense have done a much better job of trying to wear masks here, there, and everywhere when I go around. And I think that has played a big part. And you look at our numbers, and Matt could probably show our numbers right now for our area. Yeah, there's our active cases. There's our confirmed cases. The deaths, I never like to see that number. Boy, it's 110 now. I think it was around 100 last week when we did this. And I don't know if Matt has this, but the percent positive rate in terms of the tests that we do in the area and what percentage of those are positive has definitely improved. So a month or so ago, we were around 25% of the tests that we did were positive. And I think yesterday we were in the 8.9% range, 8.7% range, something like that. Actually better than the overall state average, which speaks well to our area that we have really begun to have fewer cases than we were having a month ago. Now, mind you, compared to where we were at in April, May, June, July, we're still quite a bit above that. And obviously, Christmas and the holidays are coming up here, and we'll have to hope that folks will continue to do the right things, and we won't have a surge, just like we didn't have a surge at Thanksgiving. And also, the more people that get immunized, the better things become too in terms of herd immunity. So I see light, like I was mentioning last week. I definitely see light at the end of this tunnel. And so I'm really encouraged by that. I wanted just to share our numbers at CGH in terms of we've done 15,151 tests and we've had 2,600 positive. I'm looking at last week's and we had 2,504 positive. So we've had 96 positive tests in the past week, which is still in April or May, we would have been, oh my goodness. But compared to how we were at a month ago, that's really good. So things are looking up in that regard. We've had 12,459 negative tests. And I think another sobering thing that just the reality, and we have to keep doing what we're doing, doing the right stuff. In our nation, there are over 110,000 people that are hospitalized with COVID right now, which is 3 times more than were hospitalized in September and 2 times more than were hospitalized during the height of the spring surge. My sense of that is that if you look at the map of the country, in terms of the areas where there's active infections and people are sick, it's spread out over the entire country now, whereas in the spring you had more your New York, Northeast area, Chicago. There's a hot spot in Texas, really hot for a while, same for Florida. And now it's more spread out. And I think that's why you're seeing so many hospitalizations now because of that. California has a lot of people, and when they have cases, they're going to have more hospitalizations. So that's where we're at as far as the hospitalizations go. And I think this is an interesting and sobering number, and a reason to continue to wear a mask is that with this particular virus, 50% of the people, 50% of the infections seem to happen before people become symptomatic or when they're just asymptomatic throughout the course of their illness. So that's why the masks are really helpful. And of course, the vaccines. Another sobering COVID piece of information I was looking at is that from March through July, so that's not now, but when it was going on March through July, the people that do the epidemiology on this said that there were 12,000 excess deaths in people aged 25 to 44 years of age. So most of those folks are probably COVID related. So yeah, it's real, it's happening. There's light at the end of the tunnel. My message to all of you is just to continue to do the right things, wear the masks, keep your gatherings as small as possible, and we're making progress. We really are. I'm curious to see in the next, I don't know how long. There are certain numbers. I see a question here. Let me get to in just a second. I know the governor has certain criteria in terms of when they begin to the mitigation level that we're currently at when they change that, and it seems like it's that below that 8% range for a period of time where they start to kind of change that. So I hope we get to there. I really do. And the other thing that I thought was, I don't like to get into. I'm not getting political on this, other just to say I make a comment that I see that there's a stimulus package in the works in Congress, and whether you are in favor or not in favor of spending more money, you just know that folks who are, I'm sorry, you just know that folks who are in the midst of trying to run businesses, particularly ones that are bars, restaurants, those type of things, that there's a lot of folks that this has impacted a lot. And so things that we can do we're trying to help prevent the spread of the virus, but we also have things that we need to do to try to protect those folks as well. So anyhow, there was a question, Matt. Would you put that question back up? Okay, so what does Pat have going on? When the vaccine becomes available to the general population, will providers contact us? If you're over, in Pat's cases, we're compromised and over 70, or it'll be up to the individual, just follow the news and posts. I'm not sure, Pat. I suspect different within a region, within our county, as just like with the vaccine here, there was a little lead time when we knew that the vaccine was coming. I suspect that we'll have a sense that what our supply looks like and when our supply is coming, and then we'll be able to get that message out. What I don't know is how the government is planning on dispersing the vaccine as it becomes available. in terms of will they send most of it, will they send a lot of it to your retail chain pharmacies? Will they send it to the health departments? Will they send it to hospitals and individual offices? I think that still is, they may have figured it out, but I haven't heard what the plan is. So yeah, I don't have great details for you, Pat. Just like this for the hospital vaccine side of things, we were hearing about it, but we really didn't get the, okay, here's what's going down, here's where how it's happening until, gosh, at the most a week ago. So yeah, we'll find out more. I wish I had a better answer for you, Pat. Sherry, can people with autoimmune diseases get the COVID vaccine safely? Good question. So I think the question there is about if you're immunocompromised. And right now, I don't know that we have an answer for that. Right now, we were talking about this yesterday in terms of right now they're not recommending for folks who are pregnant or breastfeeding to receive the vaccine, and then the what's called ACOG, which is the Obstetricians Society came out with some verbiage yesterday saying, well, yeah, but you can talk to your physician and have a conversation about that, whether that makes sense for you or not. And immunocompromised folks fall in that same bucket. I think the question for immunocompromised folks, and granted, we're going to find out more from the CDC in terms of what they are specifically recommending for immunocompromised patients here, I would guess here in the near future. But just speaking off the cuff, my scientific information, kind of the knowledge that I have would tell me that if you have an immunocompromised situation, the vaccine's not going to hurt you in that there's nothing live in it. You're not going to get the virus from getting the vaccine. I think the question just becomes how effective will it be for someone whose immune system doesn't fire up when they've had the vaccine. So yeah, my hunch is it's going to be okay. You can get it if you're immunocompromised. It's just going to be a question of how effective it's going to be. But I am not the CDC or the FDA. So we'll figure out, we'll learn more as time goes forward on that. But in some ways, someone who's older, as we get older, our immune systems don't work as well. We're in a sense immunocompromised. And they're still recommending for those folks to get the vaccine, obviously. Mary, let's see. Do they recommend the vaccine for those who've already had COVID? Yes, they do. So, yeah, they're recommending that you'd still go forward and get that vaccine if you've had COVID. And I know at the hospital here, what we've done is if someone has had the infection within the last 90 days, we're not prioritizing them in that first round of immunizations that we're giving just because they're already protected. We're comfortable for the first 90 days. And so we'll catch them as we get more vaccine available to us. Good questions. Good questions. And I hope that these questions become front and center for all of you listening real soon. Because my gosh, the sooner we can get as many folks vaccinated as possible, the quicker we can get in a better spot in terms of going about how we can live our lives. Okay, so if more questions pop up during the course of my conversation with Ryan, fire away, send them to me. I'll try my best to answer them. I'm sorry, I'm trying to answer them, yet I don't have all the information that I need to give you the answers that I'd like to give you right now. Okay, so hey, Matt, let's get Ryan on the line here. There he is. Hi, Ryan.
Dr. Bird, how are you?
I'm good. So hey, so everyone watching, this is Ryan Venema. Ryan is our manager of what we call EMS, or Emergency Management Services. So Ryan, welcome.
Glad to be here. I appreciate the opportunity.
Yeah. So when we get done with our conversation, we have a kind of a show and tell link video that we want you to take a look at about a couple of our paramedics, and they're going to kind of give us a tour of an ambulance. But before that, Ryan, I just want to ask you a few questions. You up for it?
Fire away.
All right, here goes. So your team's on the tip of the spear. You get out and you're out in the community, literally out in the community, in homes, helping out patients.
Absolutely.
So, during this pandemic, you guys, I'm sure, have had unique challenges specific to trying to take care of our community as you interact with them. Can you speak to some of those, Ryan?
Well, sure. Just like like anybody within healthcare, when this pandemic started, it was a moving target. We were all trying to learn and trying to adapt. And so, I think as time has gone by, our staff have gotten more comfortable, and that's one thing too. Our staff have been they've been great. They've rolled with the punches, figuratively speaking, but just there for a while. Every day we were putting out stuff. You need to do this, change that, be aware of this, and they shrugged it off with a smile like they always do, and took it, embraced it, and moved forward. So, with the emphasis of staying safe, keeping themselves safe, keeping our patients protected. But yeah, we've adapted. Things have kind of calmed down. I think we've gotten used to this norm, and things haven't changed. I think we've got our arms around it pretty good. But they've done really well. So
Ryan, does your team put on full PPE for every patient they interact with in the field, or how do they go about? How do they decide that?
Well, it's based. It kind of starts back at the call intake. So with our dispatch early on, we worked with them. They've got protocols that they go through for any type of condition that we might encounter. One of them is a surveillance tool for emergent pathogens type protocol. So if they're getting tipped off that there might be something going on, COVID related, they'll tip the medics off, and then the medics can don more PPE, respirators, gowns, stuff like that. We go into every call with a mask, face shield, or safety glasses, gloves.
And then not every call do you wear some type of N95 type of situation.
No, we always at minimum have just a regular surgical mask. And even so, when we get to a scene, sometimes there's information that comes forth that we weren't aware of. So we'll back a medic out. They can get the full PPE, re-engage, just again to limit that exposure the best we can. So patients have to be patient with us, because obviously we need to prepare accordingly. So but the guys have done well with it. We've again embraced it and moved forward, and as we have to. It's just the way it is. So.
I'm thinking about. I started when we were talking with you, Ryan, and I mentioned your emergency management services. For folks who are not in tune with what that means, those are the folks you see driving around in the ambulances. I assume that, but just so folks know, Ryan oversees our ambulance and the folks that man those. So just so you know, to that end, Ryan, do you? I've heard of EMTs and I've heard of
paramedics. Sure.
What's the difference, and how are you staffed in terms of your teams?
Yeah, well, that's a question I get all the time. We're all EMTs. Okay, so we're all emergency medical technicians, but then there's different levels. There's EMT basic, which is kind of entry level, and then as your education ramps up, paramedic is at the high end of that. We've got roughly about 29 paramedics, 15 EMT basics. Typically, when we run out, on calls, we have 2 paramedics on the truck. Sometimes it's a paramedic and a basic, EMT basic. But legally, for us to run our truck, since we're an ALS level service, we have to have at least 1 crew member that's a paramedic for us to legally run that truck. So that's kind of how we break down. So
you at least have 1 paramedic on every run.
Right.
Sometimes you might have more than 1.
Yep.
Okay.
And if we need more help on a call, we have good partnerships with both Sterling Rock Falls Fire Departments. They run with us, as with our local law enforcement, Sterling Rock Falls PD, Whiteside County. We're all in this together, and we interact well. So it's well oiled.
Yeah. How many folks work in EMS?
Within our department, we've got 44. So.
Okay.
Yep.
Okay. And how many of those are EMTs? How many of those are paramedics?
We've got roughly 29 paramedics, 15 EMTs.
Okay. Yep. All right. And in a typical day, Ryan, how many runs do your ambulance crews make?
On a typical day, we're probably looking at about 20 responses. Now, not every response that we go on is we're going to transport a patient. A lot of times we can go, we can kind of deal with the situation at hand. Doesn't require transport, or the patient chooses not to transport. And so, we provide assistance, and then they sign off. And but we probably transport 75% of the time of our total call volume. So,
Has that changed at all with the COVID? Have you had more or less call? I'm trying to say.
Yeah, it's funny because when this started, was it the third week in March? As soon as the lockdown orders came into play, our call volumes just went through the floor. I mean, we were sitting for hours not doing anything. It was actually kind of eerie. As time went by, our call volumes picked up, but then we were also seeing a lot of our calls were higher acuity. People were sick, I mean, and so we were seeing a lot of sick patients. As things kind of eased, things opened up there for a while. Our call volumes kind of picked back up and to near normal state, and now we've come back down a little bit. So it's just kind of an ebb and flow, but it's fluctuated, with the pandemic. So
I was just wondering that because I know our ED volumes are still not at the level of patients that we have seen in the ED traditionally. Since this pandemic
sure
came
in.
And we follow. I gotta think you guys kind of fall in lockstep a little bit with that.
Yeah. If they're down, so are we, because obviously we, everything we bring in goes to the ED. But so it kind of follows suit with them. They're down a little bit. We're kind of hovering right around our normal levels. So it's kind of hard to predict.
Yeah, Ryan, one of the things I wanted to ask you about was, like, for those of us those in the general public and even myself, what are some of the things that people might be surprised that your team can do in the field and in the ambulance before the patient even gets to our emergency department?
Yeah, it's, I think back over my career from when I started, and I've been involved in EMS for 29 years. And so up to this point, I know.
And when you started, was that?
Yeah, 10 years old, yeah. So no, I actually started in high school, believe it or not.
Oh, wow, okay.
I got my EMT right after that. But things have changed, so much, and it's so specialized. We can do a lot of the same stuff that they can do in the ER, not everything, but a vast majority of it. We're all going to attack a situation the same way initially, and so the therapies we can do in the field with IVs and meds and
what kind of meds can you give in the field that people might be surprised about?
Well, we've got a whole array of different meds, different sedations. We don't carry paralytics like they would in anesthesia, but all types of different cardiac meds that we'd use in cardiac arrests, different types of sedatives, narcotics, obviously for pain management, things that help us with airway placement. So we've, and not only that, but even with the EMT basic, their scope of practice has changed so much that they're able to give some of the meds, breathing treatments, glucagon, Narcan, which is a big one.
Yeah.
It's
glucagon is if your blood sugar's low, you give that.
Right. Yep. So that's we've got a ton of stuff in our arsenal, and which is great. We're kind of a rolling ER on wheels, and
sure.
A lot of specialized training. That's the thing with EMS. We have to know a little bit about everything. You can't. Some people can specialize in one particular area. We got to be able to take care of the tiny newborn all the way through your grandparents' age. So that's what makes EMS interesting, at least for me anyway. So
I remember right. You can now the EKGs that you can do on patients.
Yeah,
about a heart attack or some type of abnormal heart rhythm. You can send those to the ED ahead of your getting there. Is that right?
Yeah, we've got different alerts that we can call from the field. One of them in particular is what we call a STEMI alert, and that's when somebody's having an active heart attack. We can obviously get all the stuff done in the field, get the meds on board, IVs started, but most importantly, we're going to get that 12 lead banged out on that patient, and then we're going to send that right to the ER so they can see it. But more importantly, they have enough trust and faith, and then the training that we have, that our guys are going to call and see that that heart attack in the field on the EKG, they're going to call them and say, hey, we've got a hot case coming in, activate the cath lab, and it's called a STEMI alert. And then usually the team's there waiting for us, and the patient is whisked up to the cath lab and get those vessels opened up and reduce that, poor outcome, better perfusion. We do the same thing with strokes, call a stroke alert from the field so they can go right to the CT room and get the head scan done, and we can be aggressive with these patients because it provides for better outcomes. So that's definitely something that we strive to do very well. So
good. None of us wants you to show up at our house.
Me especially.
It's a good day. It's a good day if your team doesn't show up at my house. I'm going to tell you that right now. Nothing against y'all, but that's the reality.
No, we get that all the time. So,
but it happens.
Yep.
And I was just curious if you had any suggestions for just Joe, for myself or others who are watching this. Is there anything you could do to, prepare for the unpreparable?
Oh, sure.
When
Absolutely.
your team shows up?
Yeah, some of the things that you can do, obviously, if you have pets, put your pets away. They don't typically like strangers coming in, especially when we start having to, to work on somebody. Sometimes we encounter that. Pets can be protective, so few of us have gotten bit from time to time over the course of our careers. But, making sure the lights are on. Make sure you got house numbers that are easily seen. We have a lot of tools at our arsenal as far as finding where we need to go, and which is great. But keeping trees trimmed up so we can see the front of the house, turn the front porch light on. Obviously, if you live alone, we're not going to expect you to shovel the driveway and create a path, but
you don't
want to compromise your condition. But if there's extra people there, just having paperwork out. If you're a POA or have a DNR or whatever the case may be, all that helps us. Be able to give us a good background, a good history.
If you had, for the folks, I'm guessing people are pretty good at this, but maybe they're not as much as I think about wearing like the bracelets that would tell your team about something going on with them, or things in the refrigerator that helps to kind of.
Yeah, there's different programs out there, and we've been involved in some of them. Whiteside County Senior Centers put out stuff that you can fill out, put it on the fridge. There used to be the old vial of life that you could put inside your fridge. But yeah, I would encourage anybody, if you've got a medical condition, to invest in a medical alert tag or a necklace or something. Just again, if you're in a state that we can't communicate with you, we can kind of get to the root cause possibly. If you're diabetic and unresponsive, helps us dial things in, and we can treat you accordingly and not have a poor outcome. So
yeah, good. Let's see here, and thank you for the kind comments for those who are listening. That's great, very nice.
It means a lot. We appreciate it.
Yeah. Do you have okay? I know this is kind of always that. I'm sure people have this happen all the time where they're like, okay, do I call EMS or do I try to make it to the hospital on my own? Do you have a rule of thumb for what you would suggest to folks, Ryan, about when they should be calling 911 to get your team there?
Well, that's kind of a slippery slope there, Bill. Obviously, if you're in a condition that's compromised, shortness of breath, chest pain, think you're having a stroke, having some mobility issues, severe pain, things of that nature, obviously you want to give us a call. Let us come out, take care of you, get you transported safely. Everybody interprets emergency different ways, obviously, and for me to give the grand old, okay, thou shalt call for this and not that, it's kind of hard for me to do because everybody's situations are different. But again, major life threat things, shortness of breath, dizziness, things that possibly could create a safety issue, especially if you're by yourself. Sometimes we see some of the sickest patients pull right up to the front door of the ER, and sometimes the outcomes can be corrected, sometimes not. It can be negative. And if they would have just called us, we may have been able to prevent that. Maybe they're having some type of a cardiac abnormality, and we could have addressed that in the field, but they chose to drive themselves to the hospital and then possibly go into cardiac arrest when they get here. the list is as broad as it is wide. But I would say if you're in a situation where you're short of breath, dizzy, feel like you're going to faint, in severe pain or having mobility issues, get a hold of us. Have us come out. Like I said, a lot of times we get out there and we'll check people out. They say, oh, I'm so sorry I called you. Hey, that's what we're here for. We're a public service, and we're proud of the service we provide. We're here to help. Obviously, if you're calling us to let your dog out or feed the cat or whatever, I mean, that's a little different.
That's right up there.
I discourage that, but
right.
But again,
as you're answering this, Ryan, I think the only thing that comes to mind, your answer is that really there's not an answer, which is okay. It's a little individualized.
Sure.
The only thing I wonder about would be like if I'm by myself and I'm like, I don't know how long I'm going to do driving. To me, that would be like, I probably should call you guys. If you're not going to be safe on the road, that's the only thing that really came to mind.
You got to think about the people around you and how you're impacting other people. I've had calls where people have tried to do that, maybe have passed out behind the wheel and had an accident and maybe hit another car. These are things you got to think about. And so take that element out of it. Call us, and we can help. So
Hey, any shout outs you want to give to your team, Ryan?
My team as a whole. I'm blessed to be able to manage a great group of people, and I'm not just saying that. We feel we have a good department. We're here for the communities. There's a lot of people that put a lot of faith in us and have a lot of respect for the service, and that's something we're proud of. So again, I have the privilege of taking the vehicle for a ride, because I said it's really my cruise. Again, that I can't say enough about. I've got the best job. It's great team, great leaders within the department, great educators, and it's a tradition for us. And we view CGH EMS as a brand. And I tell staff when they hire on, protect the brand. You represent that brand, and it's something we're proud of. So, and I'm proud of it. I've been with the department 25 years, and so started as entry level, worked my way up supervisor, and I've had the honor of kind of driving the ship, if you will. I don't really drive it. I'm along for the ride too, but providing the guys what they need to provide that service, and it's a huge honor to me. It really is, and I got the best crews in the world. So
I always whenever I'm down the ED and I see your team coming in with patients, I always feel comfortable. I mean, the situation isn't always the greatest,
right?
But boy, they are very professional and do a really good job with taking good care of people. So
and we like to have fun. We're always kidding back and forth, and and when there's a little downtime, we're kidding and having fun, keeping it light, because majority of the time the job's serious enough that if you don't laugh once in a while and have fun with each other, it could get to you. But they do it with a smile and they roll with the punches, and every call is different. And the type of person that does this work has to be able to adjust, and kind of take it with a grain of salt, shrug it off, and move on to the next one. So
so speaking of the people who are going to do this job, what's your story, Ryan? What made you decide when you were in high school that you wanted to even explore the possibility of working for an ambulance service, and then why did you stick at it?
Oh boy, it's kind of funny because a lot of things, as far as my career, kind of took different paths. I knew in high school.
A picture of you with hair that I just saw?
No, that's my father-in-law. So.
Oh, okay.
That was my wife. Thanks, Tosh. I appreciate it. But no, I started in high school and kind of looking at different paths. I was looking at law enforcement. My mom's a nurse. And so, kind of just finding my way. And I actually had an opportunity as a high school student to be an intern on our local ambulance service, which I graduated from Morrison. And so I got to run as an intern on our local volunteer ambulance, and I got hooked. I really did. And but I was still looking, firefighting. I tested with fire departments, different things, and I did all my paramedic ride time here, and got to know that some of the old crew that we used to have here, and just fell in love with the department, the crews, the camaraderie. I thought this is where I want to be, and again, I hired on in '95, and I've been here ever since. So
When you came aboard, I know that now Mayor of Rock Falls, that Bill was on the team, right?
yeah, yep.
How about the Mayor of Sterling? Was Skip around then when you came aboard?
No, Skip was on with the Twin City days,
Okay.
if I remember right. And,
Okay. Yeah.
But no, I worked a lot with Mayor Westcott. Been on a lot of calls with him, and
Yeah.
so yeah, Bill. We've been in a few situations, so
I'll bet. Yeah, you guys, when paramedics get together, I've just kind of sat around tables, and it's always interesting to hear your situations that you've experienced.
Yeah, there's a lot of storytelling. Maybe a little embellishment, maybe not. But
yeah, right.
yeah,
So
it's usually entertaining nonetheless. So
yeah, you bet. Well, hey Ryan, it's been a pleasure chatting with you. And,
yeah, I appreciate it. This is a great honor. I appreciate talking with you. And
yeah, and it's thanks, and I agree with you. Your team, marvelous job. Great to have them here. Yeah, we're blessed as a community to have the group that we have. And to that end, Ryan and I are going to sign off here, but I would encourage you. I had a chance this morning to get together with a couple of Ryan's team and take a field trip in and around one of their ambulances. And I would encourage you to watch the video because it's a pretty good time, and I think it's good information too. So for everyone, Ryan, thanks for being with me. Everyone who's watching and has watched and will watch, thank you so much. I have a question to answer. Thank you so much for that. What was that question that came up, Matt? Any news on the long haulers and winter, if they will be able to get the vaccine? So long haulers, it's a real deal. There are people that have had ongoing symptoms from COVID. You know, in terms of what's the best way to help those people along, I think we are still learning that. I think they would fall in the category of folks who could be vaccinated, though. You know, they would be someone that would be able to be vaccinated. And then another question from Mary: how long are we protected from COVID after we get the vaccine? Very good question. I don't have a very good answer. I think we're going to find out more about that as time goes on, in terms of, because remember that even the Pfizer product, the information that we have is 2 months worth of data, and it's still ongoing, but 2 months is what they submitted to the FDA in terms of its effectiveness. So it's going to take some time to get a sense of how long do those shots last forever, or do you need a booster a year from now? Do you need a booster when you have your normal flu shot? We'll find that out. Good questions. Anyhow, once again, thanks everyone for listening. Stay safe. And from Julie saying thanks. Yep. And the next 2 weeks, as we're kind of bouncing again, we're pushing up against Christmas Eve and New Year's Eve. We're going to take a break, and we'll come back to you unless something really breaks that we need to talk about. We'll take a break, and then we'll plan on coming back that first Thursday in January. Or the first Thursday in January, we'll be back. So until then, thank you for listening, and take care. Bye. I'm Dr. Bird, and you just saw me talking with Ryan, and now I have with me Luann.
Hello.
And Ian.
Hi.
Yeah. And we're going to do a little field trip, or show and tell, I guess, of one of our ambulances, which you all call.
This is Med 1 or George 23.
Okay. And then I've heard Ryan call these things rigs. Is that kind of is that like the real tech? That's kind of like the trade term for these things?
A rig or a truck.
All right. So if you run into a paramedic or EMT around town, you can ask them how their rig is. That's going to resonate with them. All right. So we thought Luann really wanted to spin out and like just rip it on, but I said, Luann, come on, serious. We've got to control things a little bit more here. So we're going to just go up front and take a look at the cab. And I think there's a little something interesting up there even. All right, so come with me. Let's go. We'll take a look here. Hey, before we get in the cab, what's plugged in here?
This keeps everything charged inside the truck. It'll keep our cardiac monitor charged up so that it's ready to go. Keeps the batteries running.
Okay.
Keeps our MDB running and everything like that.
Okay, and even I'm just curious, what's that?
That's a vent.
It says Horton EV400. Is that just a vent for out?
The Horton is the brand of the truck.
Okay.
Is that right? It's the style of this particular truck that we use.
Okay, good. And even before we get in here, one other thing I wanted to ask was, are you both paramedics?
Yes.
Okay, so you're a paramedic. How long have you been a paramedic for?
About 4.5 years now.
Okay, all right. How about you, Luann?
I've been with CGH, it'll be 18 years in January.
Oh.
So yeah, I've been a paramedic for a little bit longer.
Just a little bit. Yeah, just a little bit. Okay, so let's take a look in here. Come on, Liz. Yeah, so I'm gonna let you go ahead and sit in there, Ian. Just like you like. Look at him. You can tell he has that paramedic look. What's that we're looking at there, Ian?
This is our MDB. This is how all of our calls come in. And a lot of agencies go over the radio to go en route to the call to get when they get on scene, such like that. We actually are able to do that all from the computer here.
Okay.
We're able to see who's all coming, where they're at. We have mapping systems in here as well. So it's just an all-around help for dispatch. It's computer-aided dispatch, essentially.
Okay, nice. And then is that just a scanner there in the middle?
Yes, this is just our radio.
Okay. Any other fancy things I need to know about up front here?
Not really.
Okay, all right. And we'll show it from the backside, but you can see there's a door where you have access to the back there.
Yep, right behind me.
It looks like it wouldn't be something you'd use a whole lot.
Nope.
There
But
we
it's
go.
a nice, easy way if we have to get through
Can you
back
get
to
that
help
in?
our partner or something like that.
All right. Oh, there we go. Yeah, so you'll see that when we go around the backside too. How often do you have to go back through that way?
More so, a lot of it is just if our partner needs to communicate.
Okay, so
There's
open
not
the
a
door.
whole lot of getting up and between there. Majority of the time, we'll get out and go around to the
Yeah.
back of the ambulance.
So, hey, I need a cup of coffee or something like
Yes,
that.
depending.
Now the plan here is we're going to go back and take a look at the brains or the kind of the more interesting part. Yeah, the work office. That's it. A work office. There you go. So let's start making our way back. Ian, can you there's just some stuff here too. What's going on here?
So these cabinets just have random stuff in it for rehab. We have our different tarps also for triage, where we're going to triage patients on how serious or critically ill they are from a mass casualty or something like that. We've got water. We got some flashlights in here.
Okay.
So this is just a kind of like a mass incident compartment here.
Okay. All right. Very good. All right. I'm just curious what that was. And then what's that right there?
This one is just our oxygen compartment. It
Okay.
as well has some splints and stuff like that in there. Traction splints, that type of stuff. It's just an extra cabinet. We've got some power cords in there.
Yep.
If we need to plug in the ambulance for some odd reason.
Yeah. And it looks like some sort of, you have those vice grips that you could.
Yeah, we've got some bolt cutters in there.
Yeah. Okay. Bolt cutters. I'm not exactly Mr. Bolt cutters. Yeah. All right. What do you have over here, Luann? What's on this part of the rig?
In here we have our turnout gear. We have pants and coats that we wear on car accidents and such, or fires scenes. It just keeps us more protected. It keeps out any fluid. And it also helps if there's glass and things like that around a car accident, if we have to crawl in a car. Just keeps us more protected. We have a couple other water rescue things in case we do ever have to go out on a boat for a water rescue.
Have you ever had to do that?
I personally have not had to, but
Okay.
I know they have.
How about you, Ian? Have you had to go out on a boat?
No.
No boats for you either.
Yeah,
Okay.
they have before if
Yeah.
they're looking for someone.
Yeah.
They'll put a medic on the boat also.
Okay.
We have a couple different things, a bariatric lifter thing that helps us lift a larger patient,
Okay.
Makes it easier on the patient and us.
Yeah.
Some road flares, just your average safety equipment.
Yep. Good. All right. Now we'll make our way. I think there's just so many interesting things here as you walk around an ambulance that it's power packed with stuff. Okay. So, hey, before we go into the office, if you will, I just found out while we were taking a little break here that we have another compartment I want to show you on the outside too. So come over here, Liz. Let's look. Luann's going to show us something else.
This cupboard is where we keep our backboards if we need to spinal immobilize a patient. We carry two. We also have, this is what we call a scoop stretcher.
What does a scoop stretcher do?
A scoop stretcher is, to be honest, I didn't use it a lot until recently and found out how handy it is. It actually comes apart in the middle.
Okay.
And it's side by side, so you can scoop, pretty much what it says, scoop under a patient
Okay.
and click it together underneath of them at the feet and the head,
Okay.
and lift them up
Oh,
with
wow.
that. It actually comes in very handy.
Okay.
And we have C-collars for if it's a
Yep.
neck injury. This little thing here is we call it a stair chair. It opens up and makes it very easy to get a patient out of like an upstairs apartment.
Okay.
It's got actual tracks on the back of it.
Oh, wow.
It'll actually, you just have to steady it and it'll just slide right down the steps. Makes it
Okay.
very easy for us.
Yeah.
It
I could
has it really saved our backs as
Oh my gosh, I
medics.
can't even imagine,
It's
taking,
very nice.
I think about my house if I were upstairs, and trying to get, oh my gosh. Yeah. I'm sure you have some really interesting situations trying to get folks
Yes, indeed.
from point A to point B.
Yes.
Right. Okay. So let's go in here. Ian, come on with me. And Luann. So get up in here and look at them. There they are in their office. They look it almost looks like their blood pressure came down because they're
We're home.
where their home is. Yeah. They look more comfortable. My blood pressure is going to go up here in just a minute. Okay. So Liz is going to try to follow us in here.
That's easy. Come
Come on, Liz. And I might sit over by Ian so I can put a mic by him when we want to ask questions. So this is a pretty tight little space. We'll start kind of in an order here. So Ian, would you what do we have back in the back there?
So that's our IV compartment. We have some warm saline bags up there for if a patient's kind of hypothermic a little bit. We do have some regular saline in there. We have all of our IV catheters, all of our start kits. We have some portable suction stuff in there as well for if we need to suction a patient in a house facility or in a car.
Okay.
And then just have your blood pressure and stuff like that, blood pressure cuffs.
Sure. What's below there, Ian?
We have a CPR board down there because it's not really conducive to do CPR on a cushion or a couch or something like that. So we want something hard to do our compressions against.
So like if someone was in arrest, you would literally put that board behind them?
Yes.
And then that kind of gives a little bit of
a firmness. Yep.
Okay. Hey, by the way, this is really comfortable here. These seats, they do a nice job on the padding. This is better than my office chair. This is all right. Okay, so Luann, I'm going to have you take what's up in that area there.
This cupboard here has we have some OB kits in here in case there's a baby delivery.
Okay, I got to stop you. How many deliveries have you done here in the truck?
In the truck, none. Okay. I've gotten to cut the cord in a truck.
Yeah.
The baby was already born by the time I got on. And then once in a house, I have got to cut the cord, but I've never got to the actual delivery yet.
How about you, Ian?
Nope, I have not.
Okay, all right.
That's my goal.
Well, I guess that's a good sign that our EMS folks get people who need help and they get them here.
Yep.
Yeah. And I guess if you're pregnant, most of the time you're going to try to get here on your own.
Yeah.
So, all right. So anyway, I'm sorry I interrupted.
That's okay. We got blood pressure cuffs, extra masks, our CPAP machines that we put on for severe respiratory distress patients.
Okay. Have you had to use any of those with our pandemic? And
yeah.
Unfortunately,
yes.
Okay.
But they're a very good resource that we have.
Okay. Yeah.
And then we have our oxygen equipment, non-rebreathers, nasal cannulas.
Okay.
Intubation equipment if we need to intubate a patient.
Yeah.
Our extra Zoll pads for our Zoll monitor in case we have a cardiac arrest type situation.
Yeah. So there's that monitor down there, Liz. So there's the monitor. And is that like a really fancy AED, or is that more than that?
This does have an AED capability with it, but it has. This is what our Zoll pads. It has handless type of if we have to cardiovert someone or shock someone.
Okay.
We put the pads on, then we just have to push a button.
Okay.
The old days of the thing are gone.
Yeah.
But that's what this monitor does. The monitor has the capabilities of, we do 12 leads. We can send them right to CGH.
Yeah.
So the doctor can see that 12 lead, cardiac 12 lead before we even get there.
When you started your career, Luann, were you able to do that?
No.
Okay. Yeah.
No.
So that's a nice thing for our docs.
It's all different now.
Yeah. In the ED to be able to get that information as the patient's coming towards them. And then they can even give you some guidance probably about what they recommend.
Them what do you see compared to what I see? What would you
Yeah.
like? If there's something different that they're seeing
Right.
on the 12 lead that maybe I don't see.
Right. Yeah,
And
that's good.
back and forth that way.
Yeah. Good.
Blood pressure and all that stuff is in there.
Yeah. All right. What's that little thing there?
This just has extra bag valve masks in it
Okay.
for oxygenating our
Okay.
patients.
Okay.
Got an adult and a pediatric in there.
All right. Good. Ian, one thing I'm noticing here is I always think of you guys when you do your runs. You have two of you usually. Is that right?
There's usually one driver and one person in the back.
Okay.
Usually.
There's a lot of there's like a bunch of places where you can get locked in here, like seatbelts. When would that be in use? When would you have a crew of folks back here?
When you're working that cardiac arrest that we were talking about earlier, or high acuity call, maybe a severe stroke or something that you're going to need the more hands than the one paramedic can do.
Okay.
And a lot of times we actually have the fire department drive for us, and then the paramedic or the partner up front would jump in back with us.
Okay. So that's when these come into play
Mhm.
here.
It can get pretty full in here sometimes.
Yeah.
When we put a couple
people doing a
extra.
code.
Yeah.
Okay. All right. That makes sense. Okay. Good. So talk me through here, Ian, these areas over here.
So the compartment right here just has some saline in it and some sterile water for flushing stuff out,
Okay.
or just needing some sterile fluids for something. Then over in these compartments here is our linen, and then our trauma stuff, where we
Okay.
have different hot, cool packs, different gauze, bandages, blankets, stuff like that. We have some chest seals in there for if a patient has a chest wound.
Oh, wow. Okay.
We
That
can
could
kind of
happen.
seal that up,
Sure.
and hopefully then we got some burn blankets and major trauma.
What makes something a burn blanket? What's unique about that?
It's just sterile, pretty much.
Okay.
And it's just something we can put over the patient that's sterile, because if they have some burns, there's already a high risk for infection. We
Right.
don't want to make that worse by putting a blanket on them that we know
Okay.
isn't sterile.
Sure. What's that little thing then?
Down here we have our PPE, just for different,
Okay.
obviously with the pandemic that we're in, we're
Yeah.
using a lot more PPE,
Sure.
gowns, masks, and such.
Okay. All right. And then we're gonna look behind us here. And what do we have up in this area here? What's going on here?
This is just an area for us to like have our wipes and stuff like that, and then just some other paperwork stuff that we need for calls, transfers, and stuff like that.
Okay. I see oxygen.
Yep.
Which is a big part of, you need that. How much oxygen do you have on here? Like how long could you have
Quite a
someone on
while. Quite a while.
Yeah.
We have with that big tank out there, when we have 2-3 portable tanks in here usually as well, so we
Okay.
can go quite a while on oxygen.
Okay, so not a big issue
No.
in terms of running out of oxygen, even if you have a long run with somebody to
No.
go up to Rockford or
Oh
Chicago.
yeah, no, it would take a lot more than that.
Okay, all right, good. As I'm looking around here, one of the other thing that strikes me is, it's a lot of stuff here. If you have a busy call, how long does it take to get this place back together? once you've done that.
It can take anywhere from 2-3 minutes after a call, after making sure everything's clean and stuff, to sometimes an hour and a half.
Because I'm wondering, with the pandemic
Mhm.
and someone that has an infectious disease and everything, how do you do that in terms of here in the truck?
That definitely adds a lot of time.
Yes.
Because we need to go through and we wipe down any surface that we can touch, basically, that we can get to
There's a lot of
with our
surfaces.
wipes. Yeah.
Or that the patient can reach through respiratory stuff,
Yep.
droplets, stuff like that.
Okay.
So there's quite a bit of cleaning involved after every call.
Yeah, I've got to think that adds to your time. Just
It does.
every time you have a
Mhm.
situation like that. Yeah, and one other thing, this is kind of an important piece of equipment. And if I remember right, this is new and improved from when you started as
Yeah,
well,
oh,
Luann.
definitely.
You've probably had this all the time. You've
Nope.
been no,
Nope.
this is new for you too. Oh,
We'll get some lights here.
okay, we're back. We're back in the light here. There we go. All right. So tell me a little bit about this stretcher. What's unique about this?
So this stretcher is what's called a power stretcher. It does everything on its own. There's no lifting on our part.
Yeah.
Which is great, once again, for reducing those back injuries and stuff like that. Multiple seatbelts to make sure our patient's secure, because just like we got to wear seatbelts in our cars, patients need to wear seatbelts on the stretcher.
Sure.
We carry the oxygen on it. And like I said, it'll actually come out on its own. You can almost do it.
You hit a button and it kind of, wow.
Yep,
All
and
right.
it's very simple. I've seen young kids be able to do it.
Okay. If we had more time, I'd put myself on, then we'd do it. But just trust them that that's how that works. So, okay. So anything else that I haven't asked you about this work area that you would say, you know what, folks that are listening might be interested in that, knowing that?
I think the only thing we didn't talk about is this bag,
Okay. Tell me
which
about this
is
bag.
actually one of our most important things. This is called we call it our jump bag,
Okay.
meaning this bag goes into every house with us.
Okay.
If we go on a call, this bag goes in with us. It has our blood pressure, all of our first round vitals,
Yeah.
blood pressures, pulse ox. We have an IV set up in here. First round medications as far as for cardiac, aspirin, that kind of stuff. On the inside, we have everything we'd need to intubate someone, do an IO, IVs. We got a CPAP in there also.
Yeah.
Pretty much everything in a drug bag that we carry the same amount of drugs basically in there as we do in there, except for narcotics.
Yeah.
It's
We only
basically
carry
the
narcotics.
ambulance brought down to the first 10 minutes. I mean,
Right.
this is a lot of double stuff, but
Yeah.
it's a lot more condensed, so we can work a little bit quicker in
Yeah.
the house.
Yeah. Okay.
And it's not very light. You can pick it up that we
Yeah. That's,
we tote that
that's-
upstairs and
That's
everywhere.
solid. Yeah, that's solid. That'll get your heart beating if you walked around with that thing a little bit. So good. Well, I'm glad I asked that question because this is a very important piece of this rig here. So rig, get that? I'm already throwing out the
Got
terminology.
the lingo.
All right. Hey, Ian, Luann, it's been a pleasure. Thank you for giving us a
Yes.
great guided tour of
thank
an
you.
ambulance.
Thank
Yeah. Thanks for all the work that you do.
Thank
Really
you.
appreciate it.